pleasure to have like a Brigitte Madrian with us today at the Distinguished Speaker Seminar. Brigitte she's one of us. She obtained her PhD in economics at MIT, like great place to have a PhD in economics. And after that, he had positions at Harvard, Chicago, and UPenn. And now she's at BYU, where she's the dean of the business school. And Brigitte is a behavioral economist working in household finance, which that means basically that among other things, she likes to play psychology tricks with us individuals of limited rationality in order to make us save more and invest better and have a better life. And we owe her for that. And you know, again, and I have to say that she was my very esteemed colleague at Harvard for, I think, about 10 years. And it's just such a great pleasure to have you here. We know that you have many things to do, and we are really happy that you're taking the time to come to MIT virtually. So now the floor is yours. Take it away.
Okay, thank you, Alberto. I have lots of warm feelings in my heart about MIT, and I was thinking over the last few days as I was getting ready, what was I doing at this point in time at MIT? And I kind of realized that 30 years ago in March was when I settled on what I was going to write my dissertation on at MIT after several long months of anxiety around what am I going to have to say that's important to anyone. I finally figured it out 30 years ago when I was at MIT. So I'm going to give a bit of a high-level overview talk today, and I titled it, I'm going to share my screen here, Thinking Outside Disciplinary Boundaries, Applying Behavioral Insights to the Design of Public Policy. And as Alberto noted, he and I were colleagues at the Harvard Kennedy School for 10 years. And I guess one of the interesting features of my background is I've spent a little bit of time in a formal disciplinary department in the economics department at Harvard. I'm now at my third business school, and so far a total of about 15 years at business schools, and then almost 13 years at the Harvard Kennedy School, which is of course a public policy school. So I kind of straddle these different approaches towards thinking about academic problems. But in my heart of hearts, I'm really interested in public policy. As Alberto mentioned, I was trained as an economist, got my PhD in economics at MIT, and economists, at least when I was trained, have a very specific way of thinking about government intervention into the economy. So economists think about a set of traditional economic motivations for public policy. The first is we have market failures. So situations in which unregulated markets don't work well. And there are four traditional ways economists think about this. One is market power. So if you have a company that's extremely large, think about a Google or a Microsoft, large enough that they can use their weight to influence outcomes in the marketplace. The case of public goods, where people can benefit without actually paying for the good. The case of externalities, and we're certainly seeing that with this pandemic. Individual behavior has impacts on other people. And then when there are information failures, when one side to a transaction has more information than another side. So this is one set of categories for when government might intervene in the economy. A second is if a market is just completely missing for some reason. And then the third is if we have distributional concerns. So we think the markets are functioning well, but at the end of the day, some people are really well off and other people not so well off. And maybe if we value equity, there might be a reason for government to intervene and generate more equal outcomes. So these are the traditional motivations for public policy intervention. And then economists have talked about a fairly traditional set of tools to remedy some of these problems. So I'm just going to quickly talk about the way a traditionally trained economist would think about the tools that you use to address market failures. So in the case of market power, a company that's really large, the traditional policy tools would either be public provision, so have the government come in and provide the service. So you can think of governments that have taken over things like telephone provision or utilities, or you can regulate. Instead of having the government provide it, you can have the government regulate those things. And indeed, we see extensive regulation in some of these spaces, either regulation of prices or regulation of market structure. So market structure would be when can firms merge, or if a firm's too large, the government might go in and try to break it up. So some combination of government provision, price regulation, or market structure regulation. The second market failure is in the case of public goods. The traditional tools that we see in the case of public goods are once again public provision by the government. We see direct subsidies for private provision. So the government will pay for more of a good or service to be provided by the private sector. Tax subsidies for private provision through the tax code, and then regulation for certain types of things that have a public good aspect. So for example, a patent would be a good example of that. In the case of externalities, we see a lot of use of price incentives. So for negative externalities, we'll see taxes that are put in place, penalties, fines, things like that. In the case of positive externalities, we'll see subsidies. So in the case of the COVID-19 vaccine, I don't know if this is a national policy or a state policy, but at least here in the state of Utah, the COVID-19 vaccine is being provided for free to citizens. The state government is paying for it to encourage people to get the vaccine. Or we'll see regulation, prohibitions of things that are bad and generating negative externalities, and mandates for things that are good and generating positive externalities. And then the last category of market failure are information failures. And the traditional policy responses that we see are disclosure requirements, mandates around things that have to be done or can't be done, some use of subsidies, and some use of regulation. So this is kind of how a traditional introductory economics textbook would frame the case for government regulation in the economy and for the types of tools that government might use. Now, I'm a behavioral economist, so I have spent much of my career over the last 15 or 20 years thinking a little bit more expansively. And I've got a quote here by David Halpern. David Halpern was the first director of the UK's Behavioral Insights team, which was the first formal attempt by government to incorporate I would say a broader variety of social science perspectives into economic policy making. And he said, a lot of our policy models are traditionally based on a rather naive understanding of what drives behavior. But if you have a more intelligent, nuanced account of how people make decisions, you can design policy that is more effective, less costly, and makes life easier for most citizens. So this is my definition of what behavioral economics is. So when I teach behavioral economics courses, this is what I tell my students, that behavioral economics incorporates insights from economics and other behaviorally oriented disciplines, including psychology, sociology, anthropology, and cognitive neuroscience, to enrich standard economic models in ways that improve our ability to understand and predict human behavior, market outcomes, and public policy. And so when I think about what does behavioral economics bring to the table in terms of public policy, I think of three different things, and I'm going to focus on one of those three today. So the first is it gives us additional motives for public policy intervention. So in addition to the market failures that I just talked about, it gives us additional reasons why markets might not work well, and that might justify a case for public policy intervention. I'm not going to spend a lot of time on this, but one example would be individuals are too focused on the present relative to the to the future, or individuals have self-control problems, things like that. Second, behavioral economics gives us an additional set of policy tools to think about, many of which are much more cost-effective than the traditional tools that economics has focused on. And that's what I'm going to spend most of my time talking about today. And then third, it gives us ways to think about how to increase the effectiveness of traditional policy tools. So I'm going to talk about some of these additional public policy tools in what I think is a very policy relevant context right now, which is getting vaccinations. Now, we don't have a lot of data to work with on COVID-19 vaccinations, although that is the most pressing public policy issue right now, is getting the supply of vaccine out and then getting the public vaccinated. But we have lots of data from flu vaccines. So I'm going to start off with a question to you. Did you get a flu shot last fall, winter? And by last fall, winter, I mean not like November, December that just passed, because admittedly we are in a little bit of crazy times, but think about a year before. So think about fall, winter of 2019. Did you get a flu shot? And if you didn't get a flu shot, what are the reasons that you didn't get the flu shot? So while you're thinking about that, I'm going to show you some data. This is from the US. So the light blue bars in the back are the kind of the target vaccination rates that public health authorities are aiming for different demographic subgroups. So I would say most of us on this the seminar today are kind of in this group right. Probably this group right here, adults 18 to 64. So the target vaccination rate is about 80%, and the actual vaccination rate is in the darker blue. It's about 25%. So there's a big gap between what public health authorities think is the appropriate vaccination rate given what they know about the costs and benefits of the flu vaccine, and how many people are actually getting vaccinated. Now, when I ask my students, when I teach class, did you get a flu vaccine and why didn't you get a flu vaccine? I get a variety of reasons. I'll come to that in a minute, but let me just talk through the economics of this for a minute. So if an economist was trying to explain kind of the gap between, say, this 80% and the 25%, the way an economist would think about it is, well, we have a vaccine supply and we have vaccine demand. And in this chart right here, the demand is being driven by the social benefit of the vaccine. And this Q star over here is the socially optimal vaccination rate. But the issue in the market for vaccines is that vaccines generate a positive externality on others. So the benefit that I get as an individual is lower than the total social benefit. So individuals left their own devices are not going to account for the benefit that my vaccination engenders for other people, and we're going to end up with a vaccination rate that is a lot lower than what is socially optimal. And economists like to talk about what they call the deadweight loss. So this is the loss in value to society from the fact that I don't take into account the positive benefits that my getting vaccinated generates for other people. And as a result, too few people get vaccinated. So this is how an economist would think about this. And then an economist would think about, well, what are the traditional tools? How could I encourage more people to get vaccinated? And the primary tool used in this realm has been to subsidize vaccination. So this is what public policy authorities are doing right now, making the COVID vaccination free. So if we come back to this chart right here, I'd put in a subsidy equal to the distance between these two demand curves. And if I put this subsidy in place, Some people will go get the vaccine who wouldn't have otherwise, and I can get to the social optimum. But the cost of this public policy is the area of this blue rectangle. So yeah, I can move back the vaccination rate from Q1 to Q star, but I'm going to have to pay the cost of this giant rectangle in terms of a subsidy to get there. So that's how an economist would think about this. So we could subsidize consumers, that would increase demand. We could subsidize providers, that would increase supply, and we could get to the same outcome. We could mandate vaccination, and we do that in some circumstances. So I remember when I was a graduate student starting at MIT actually had a policy that you had to have a certain set of vaccinations before you could attend school. So I had to be current on all of my vaccinations. And then the question is, how well will these tools work? So as I just noted, subsidies can be pretty expensive. Mandates, as we've discovered in the midst of this pandemic, can be politically tenuous and can be hard to implement for adults. And I'm thinking here in particular about mask mandates, but I think we will see the same thing with vaccine mandates if governments end up deciding to go the route of mandating a COVID-19 vaccine. And then the question is, how much will they actually change behavior? Now, when I ask my students when I teach class, well, why didn't you get the flu vaccine? Well, if you're trying to think about the reasons why people don't get a flu vaccine and how effective these traditional public policy tools are going to be, if our go-to public policy tool is to change the price, to subsidize vaccination, that's a great tool if the reason that people didn't go get the flu shot was because the flu shot was too expensive. Now, I don't know what you all were thinking about why you did or did not get a flu shot, but I will tell you in my many years of teaching behavioral economics courses and asking students this question, I have never had a student tell me that they didn't get the flu shot because the flu shot was too expensive. That is not a reason that students give. And this includes, traditional college age students, but I also teach executive education, kind of older adult students. Nobody says the reason I didn't get the flu shot is because it was too expensive. And yet the lever that we're using to try and change behavior is to lower the price. What are the reasons people do say for why they didn't get a flu shot? A lot of people will tell me that they actually had good intentions, but they forgot, or the flu clinic was inconvenient. If it had been a lower time cost, they would have gotten it. Or lots of stories around beliefs. People mistakenly believe that the flu shot causes the flu, or people mistakenly believe that they have superhuman immune systems and they will never get the flu. But if these are the reasons here why people are not getting the flu shot, reducing the price is not necessarily going to be a very effective lever, or at least a very cost-effective lever at solving the problem. So when I talk to my students about, how do you think about changing behavior in the way that we want for good public policy? The first question is to ask is, do organizations or individuals want to change their behavior? Because you're dealing with a different set of problems if people want to act differently, but they're just having a failure to follow through on the good intentions, versus people want to do something that's actually contrary to public policy. So if people want to change their behavior, then why aren't they? What are the barriers? Is it that they're forgetful, for example? And if not, can we change what people want? So we could change by what people want with financial incentives, tie something that people want, money, with something they want less, a flu shot, or we could try and change what people want through other approaches. And then which approaches are going to work best for whom, in what circumstances, and at what cost. So I'm going to talk now about some of the kind of what I'll call more behaviorally informed ways to think about changing behavior, once again, using flu vaccines as the context. So let me come back here. Do people and organizations want to change their behavior? And if yes, why don't they? So let's talk about from an analytic standpoint, how would you think about this in terms of a traditional economic model? So here's our graph that I showed you a little while ago, where we've got this demand curve here. This is the benefit to society from having people get vaccinated. Here's kind of our observed demand curve, the rate at which people are actually getting vaccinated. And the presumption is this is how much individuals value vaccination. But there's a third alternative in here, which is maybe individuals really value getting vaccinated over here, D3, which is much closer to the social optimum. And the problem is that there's this gap between their intentions and their actions. So they forget. I really do want to get a flu shot, but I just forgot about it. Well, it might be much less costly to close that gap than with the big subsidy that generated the big blue rectangle that we talked about earlier. Or let's suppose that individuals have mistaken beliefs about their superhuman immunity or the likelihood that the flu vaccine actually causes the flu. And here's the observed demand curve based on these mistaken beliefs people have. If we could change their beliefs, maybe we shift the demand curve, and that now gets us to something closer to what is socially optimal. And it might be more cost effective to try and shift this demand curve than it is to go in and subsidize things, the big blue rectangle, with the existing observed demand curve. So I'm going to give you some examples. Alberto in the introduction cited my research on how to get people to save more for retirement, and that is where I've spent most of my time doing research over the last 20 years. But I've always had this little side hobby in things related to health, and in fact, my dissertation when I was a graduate student, the topic that I lit upon 30 years ago in March, had to do with health insurance. So I have this little side gig in health and have written a few papers on in fact, getting people to get a flu vaccine, but from a behaviorally informed standpoint. So I'm going to talk about some of that research that I've done and also research that other people have done that I think gives some insights on how to think about why some of these behaviorally informed approaches are much more cost effective than the traditional economic approaches to changing vaccination behavior. So the first paper I'm going to overview really quickly is a paper on what's the impact of location in whether or not people get vaccinated. So we did a study, me and some collaborators did a study a few years ago with a large company in the Midwest. And this company had a corporate headquarters, and at their corporate headquarters, there were two buildings that were connected with a covered walkway. So you could get from one building to the other without having to go out into the rain or snow. But you had to swipe your badge to get in between building 2 and building 1. And so we collected data on the travel patterns of employees because you had to swipe your badge when you went between building 1 and building 2. We could follow employees and we could see, well, which employees are going back and forth between these two buildings frequently and which employees are spending all of their time just in building 1 or just in building 2. So we identified the employees who were staying in their own building versus going back and forth between the two buildings. And then we looked to see what happened one fall when the company opened up a workplace-sponsored flu vaccination clinic. So I don't know if MIT does this, but I know lots of universities and other workplaces, because having their employees or their students vaccinated against the flu is a good thing, they'll have a free flu clinic in the fall. So this company did that, and they physically located the flu clinic here in building 2 in a room right next to this walkway, walkway door. And so we look at what's the likelihood that you get a flu vaccine. And we compare employees who have travel patterns where they're frequently going between building 1 and building 2 on days when there isn't a vaccine clinic versus employees who just spend all of their time hanging out in building 1. And we find that people who have lots of reasons to go over to building 2 and are walking right past this flu clinic, 47% of them get a flu shot. And for the infrequent door users, 40% of them get a flu shot. So what this suggests, at least to me, is that the location of this vaccination clinic actually is a pretty powerful determinant of whether or not you're likely to get a flu shot. So 2 factors at play, which we can't really tease out in this particular study, but one is how convenient or inconvenient is it? But second is that if you walk right by the clinic, if you had forgotten, that's a reminder. So a convenient location for the clinic reduces the time cost, but it also serves as a reminder of this thing that, based on kind of anecdotal data, a lot of people say, oh, I intended to get a flu shot, but I forgot about it. So putting the flu clinic in a easily accessible location would be a behaviorally informed approach to dealing with the reasons why people aren't getting vaccinated in the first place. Okay, here's another example, and this is a research study that I didn't do, but it's one that is very related to some of my early work on how to get people to save for retirement. And so the idea here is, what if you just tell people that you have given them a default time to go get their flu shot? Now, you can't enforce compliance, but just send people an email and say, you need to go get a flu shot. So this was a study done by Gretchen Chapman and some co-authors. Gretchen is at Carnegie Mellon. And this was at another large organization with a free flu shot clinic. And employees were divided into 2 groups. And one group received an email that said, here's when we're having our free flu shot clinic. Here's the link that you can click on to schedule an appointment to go get your flu shot. And then if you registered, you would get a later reminder email. And then another group of employees got an email and it said, dear, Kimberly, you are supposed to show up for your flu shot at 10 a.m. on Thursday. And then it had a hyperlink that you could click on if you wanted to cancel your appointment. And if you didn't cancel it, then they would send you an email. Now, in both of these conditions, the way flu shot clinics typically operate is you can just show up and get your flu vaccine. With or without an appointment, you show up. It doesn't take that much time. Not a big deal. So this giving you a default time to get your appointment is really a psychological mind trick to get you to buy into the idea that you should put this on your calendar and actually show up. So what do they find in this study? So if you didn't get a default appointment, about 1/3 of the population showed up to get a flu shot. And if you got this email reminder, 45% of the population showed up to get a flu shot. So that's a pretty big effect for the cost of sending out an email. But what's really interesting is if you look at the patterns of behavior. So the sample size in this study was about 500 people split between a default flu appointment. So that's the column on the left, and the opt-in sign up for a flu vaccination. So you can see the 45% versus the 33%. But look at kind of the rest of the chart underneath the group on the left who were given the default flu shot appointment. So 239 people are given the default appointment. Very few people cancel it. Okay, so they don't go through and cancel it. So most of them are keeping the appointment, but only 45% are getting vaccinated. So a lot of people, they don't read the email. Who knows what happened? We don't know whether they didn't read the email, they read the email, they forgot, whatever. They didn't cancel the appointment. But of the people who got vaccinated, here's what's interesting to me. Only half of them went at the appointed time. So we sent you an email, we said, go get your vaccine at 10 o'clock. And only half of the people who actually get vaccinated went at 10 o'clock when we told them to get vaccinated. The other half walked in on their own at some other point in time. But just this email making it feel like, we think this is important enough that we've given you a default appointment, leads people in, significantly larger numbers to feel like they should actually follow through with the flu shot, even if it's at a different day or time. Okay, here's another type of a behaviorally informed intervention, and this was a study that I worked on a few years ago. And this is based on a long literature on helping people achieve their goals. And one of the things that works is making a concrete and specific plan. And this literature, my guess is many of you are familiar with attempts to get people to make a plan to go vote, because this is now a standard type of intervention being done with elections, particularly high-profile presidential elections, is that people will call you up and try and get you to make a concrete and specific plan to go vote. So this is a variation on that type of an intervention. And the idea was to get people to make a plan about when they're going to go get their flu shot. So this is, once again, is an employer-sponsored free flu clinic. And the employee population was divided into some different groups. So one group, the control group, they just got a flyer in the mail saying, companies holding a free flu clinic, here are the dates and times when you can show up and get your free flu shot. So that's the control condition. Second group of employees gets a similar mailer, and here's the information when the flu clinics are being held, but then they're prompted to write down when you're going to go get your flu shot. No one's going to see whether or not you write this down. You didn't have to send the form back in, but write down the day of the week, when you're going to go get your flu shot. And then we had another version of this, which was had a greater level of specificity, write down the day and write down the exact time when you're going to go get your flu shot. So what do we find? If we have no planning prompt, about a third of the people go get a flu shot. That was almost exactly the same number as in the study on the default flu shot, which was different location, different group of employees. If we ask people to plan a date, it goes up to 35.6%. If we ask them to plan a date and a time, it goes up to 37%. The marginal cost of doing this intervention versus this intervention is zero, because the flyer was being sent out already. So we've taken insights from psychology, namely that planning helps people increase the likelihood that they'll follow through on something, and redesigning the communication to incorporate that planning element. And for zero cost, you get 4% more people, a 4 percentage point increase, which is about a 10 to 15% increase in the fraction of people getting a flu shot. We did something similar with getting colonoscopies. This is just a little side detour for people who are overdue to get their colonoscopy appointment. One mailer just saying, go get a colonoscopy. Second mailer actually had a yellow Post-it note on it that's, prompted you to write down when your appointment was. And here's the flu shot results that I just showed you. And with the colonoscopy, if we ask you to make a concrete plan about a date and time, it's a 1 percentage point increase, but in relative terms, it's about a 15% increase, which is about the same relative increase with the flu shots. Interestingly, with the colonoscopy study, we went through and we stratified the results based on what kind of demographic, by various demographic characteristics, but we had people not who were part of the study kind of categorize how forgetful do you think someone with these demographic characteristics is. So the overall effect was about a 1 percentage point increase. People think that men are more forgetful than women. I'm not arguing that that is true. I'm just saying that if you do a survey of 1,000 people and you say, who's more forgetful, men or women? The 1,000 people who answer your survey will tell you that men are more forgetful than women. And the effect was bigger for men than for women. People will tell you that individuals who have children are more forgetful than individuals who don't have children. As a parent, I'm here to tell you that I absolutely believe that. And the effect is stronger for people with children who other people think are more forgetful. If you didn't take action the first time around, the effect is larger, and that would be consistent with forgetting. The effect is larger for those who are over age 75 and individuals. We know that memory declines with age, and no difference based on the generosity of your health insurance coverage, but no reason to think the generosity of your health insurance coverage would make you more or less forgetful. So this is an intervention that works for the type of people who are inattentive or forgetful, and helps them overcome some of the problems that they're having. Now, the last couple of flu shot studies I'm going to talk about really quickly come from a study that was just released a couple of weeks ago that I was part of, called a mega study of text-based nudges encouraging patients to get vaccinated at an upcoming doctor's appointment. And this was a collaborative effort with something like 36 researchers across 10 or 12 different institutions, testing, I think, 18 different text-based approaches to encourage people to get a flu vaccine last fall, when they were going to see the doctor for an appointment they already had on the books in the first place. And this study's gotten a fair amount of press in the last couple of weeks, mostly because of its potential relevance to COVID vaccination efforts. So in this study, the baseline vaccination rate was 42%. And the most effective intervention was a set of text messages reminding people that their doctor had a flu vaccine set aside for them. So, John, this is a reminder that a flu vaccine has been reserved for you at your appointment with Dr. Smith. Or another variant that was studied, a flu shot has been reserved for you to receive at your appointment tomorrow. Reply yes if you want this shot held for you, no if you don't. So in the control group, 42% of people asked for the flu shot and received it at their doctor's appointment. And then there were 3 different versions of these "we've reserved it for you" messages, and their effectiveness ranged from 45 to 46%. So really low cost intervention that gets you, about a 4 percentage point increase in vaccination rates. My little piece of this giant study was a health behaviors quiz. So we would text people who had an upcoming appointment and ask them a series of questions. Yesterday, did you walk at least 10,000 steps? Yes or no? And then how about your diet? Did you eat 4 to 6 servings of fruits and vegetables? Yes or no? And finally, did you sleep at least 8 hours last night? Again, yes or no? And many people are going to answer no to all 3 of these questions. And then the last text, that's 0 for 3 or 1 for 3. Those are tough goals to achieve. It's flu season, and getting a flu shot at your upcoming appointment is an easy thing you can do. Be sure to ask for your flu shot. So in the psychology literature, this would be an example of a contrast effect. Here's some things that are hard, might make you feel not so great about yourself. Here's an easy thing you can do, and it seems easier when done in comparison to these things that are hard. So the baseline, once again, 42% get a flu shot. With the hard health behaviors quiz, it's about 45%. We had a different version of this quiz, which was easy health behaviors. And that was less effective because you don't get the same strong contrast effect. Okay, so I've given you a whole bunch of different behaviorally informed approaches to increase vaccination, flu vaccination rates that are linked to the reasons why people tell you they don't get a flu vaccine. Don't get a flu vaccine because I forget, I'm inattentive, and these are things that help overcome the problems that people actually have. Now, if you look at the cost effectiveness of some of these approaches, so this is from a study that was done 3 or 4 years ago, not doing actual interventions, but drawing on all the literature where interventions had already been done and just calculating their cost effectiveness. Here are some traditional interventions. So the adults vaccinated per $1 spent for a financial incentive is 1.8. For a free vaccine, it's 1.1. A subsidy would be not only is it a financial incentive would be the vaccine is free and I'm going to pay you $10 to go get it. Subsidized would be I just make it free. Relative to the planning prompts, so that's the study I showed you earlier, for each dollar spent, we get 12.8 people vaccinated. For a default appointment, it's 3.7 people. So these approaches that are grounded in the reasons why people aren't getting vaccinated are actually much more cost effective. Now, as Alberto mentioned, a lot of my research has actually been on savings. That's my kind of primary focus. The health stuff is a little bit of a side gig, but we find similar things when it comes to the savings literature. So if you ask people, why are you not saving? Very few people will tell you, I'm not saving because the rate of return is not large enough. You know, they're not saying it's a financial reason. The price of saving is not high enough. The interest rate is too low. That's why I'm not saving. That's not why they don't tell you. They tell you, you know, I want to save. I just haven't gotten around to signing up for my 401k plan. Or they tell you, I don't know how to save. It's really complicated. I don't know how much I should save, what to invest in. Or they tell you that they've, you know, had good intentions. They forgot to. Those are the reasons people give you. So I've done research on a whole bunch of different ways to try and get people to save. And when I teach class, I will start off and I'll give my students a quiz and I'll give them, you know, here are 10 different ways we could help people save. I want you to predict how effective these are going to be. So one would be a financial incentive, like let's give people a match of 50% on what they're going to save. And my students will tell me that this is going to have, you know, a pretty big effect, a medium to large effect on helping people save. And the evidence is that the effect is actually pretty small. If we look at a different type of incentive, a lottery type incentive, they'll tell me that's going to have very little effect. And in fact, the effect is somewhat larger. And that's because you can design a lottery to take advantage of some of the psychological biases individuals have. And then I'll give them a bunch of other approaches. I'm not going to go through all of these, but some of these approaches down here that are more behaviorally informed, you know, they'll say this approach is going to have small effect or no effect, but the actual effects are often significantly larger. The green boxes are the actual effects than what individuals naively thought in advance. So if you do this kind of same exercise, what's the effectiveness of $1 spent in increasing annual contributions to retirement savings accounts? Here are a bunch of financial approaches, and you get, you know, between $1 and $5 of additional savings for each dollar spent, versus a behaviorally informed approach, which is just force people to make a choice and don't let them procrastinate. Do I want to save or do I not want to save? Which is, you know, much more cost effective. We see similar things in terms of getting students to enroll in college. Financial incentives have small effects. Helping them fill out the complicated financial aid form has a huge effect. We see it with energy conservation, giving people discounts to adopt measures that will reduce their energy usage, have small effects. Appealing to, say, social norms about, you know, this is how you compare to your neighbors, much more effective in generating energy conservation behaviors. So in conclusion, what does behavioral economics bring to the public policy table? Brings additional motives for public policy intervention, brings additional policy tools. So I've talked today about tools to help agents execute their preferences, to bridge the gap between their good intentions and their actions, or tools to shape their preferences, namely to shift the supplier demand curve. And it gives us some ways to increase the effectiveness of traditional public policy tools. And the bottom line is that when you bring more tools to the table in terms of thinking about how to influence policy outcomes, you get better outcomes at a much lower cost. And with that, I will stop sharing my screen, and I would be happy to take questions until Fatini says it's time to stop.
This was really terrific, Brigitte, and definitely felt very timely given, the COVID vaccination effort.